Use ceiling suspended screen, lateral shields and table curtains. They provide more than 90% protection from scattered radiation in fluoroscopy. Mobile floor shielding is advisable when using cine acquisition. Keep hands outside the primary beam unless totally unavoidable. Hands inside the central area of the primary beam will increase exposure factor and doses to the patient and staff. Only 1 to 5% of radiation falling on the patient's body exits the other side. Stand on the side of the transmitted beam, that is by the detector, which contains only 1 to 5% of the incident radiation and its respective scatter. Keep exit tube under the patient table and not over it. Under couch systems provide better protection from scattered dose. Use personal dosimetry. Use at least two dosimeters, one inside the apron at chest level, one inside the apron, one outside the apron at neck or eye level. Additional finger ring dosimeter for procedures requiring hand close to the primary beam. Real time dosimeter system are used. Update your knowledge about radiation protection. Address your concerns about radiation protection to radiation protection specialists, medical physicists. Remember, quality control testing of fluoroscopy equipment enables safe and stable performance. Know your equipment using the equipment's features appropriately to help reduce doses to the patient and staff, and use injection devices. Some practical tips are that keep calm and use your brain. Think safe, work safe, be safe. Patient position. Patient position should be away from the radiation source to lower the skin dose. The image detector should be placed close to the patient to lower the necessary dose, less geometric blurring. The tube should always be positioned under the table under couch configuration, less scattered towards the personnel's eyes. Keep the patient extremities out of the beam. So the correct technique, lower exposure and good image quality. Incorrect technique, high exposure and blurred image. Tube angulation. The use of tube steep angulations should be minimized and used only if necessary. Each 3 centimeter additional tissue doubles the dose to the patient. Factor of 10 each 10 centimeter. X-ray need to penetrate more tissue and the source to skin distance is reduced in the figure as shown. The tube angulation. Tube angulation. Using small angulations actually reduces the peak skin dose of the patient. Moving the X-ray beam to different areas of the patient's body during procedure lowers the peak skin dose. Good practice is that every 30 minutes you should change the beam angle. Magnification will increase the patient dose. Beam energy is condensed to a smaller area. Use the largest field of view possible for the procedure being performed. The difference in skin dose between the larger field of views and the smallest is a factor of nearly 4. In modern system there is a live zoom feature without additional radiation and without significant degradation of the image. Dose rate versus field size as shown in this graph. Collimation. A collimator is an adjustable LED shutter located at the exit of X-ray source that can be closed down to limit the irradiated area. Appropriate collimation should be used for the imaging task. This lowers both the patient dose and the staff's dose. Modern systems should be equipped with virtual collimation, 50% field of view and 100% field of view. System settings. It is important to know your system and its options. Make sure using the lowest dose setting when possible. Talk to the manufacturer or technician to set the initial dose setting to low dose. Increase when necessary instead of lowering when possible. Less chance to forget. Use the proper frame rate, lower when possible, that is 7.5 frames per second is standard. Use the proper acquisition program. Make sure when buying a new system that it has proper filtration. CU filters out of the low energy X-rays, lowering the skin dose. Select the proper program. Select proper dose level. Select the proper frame rate, 7.5 per second. So the summary is that for patient safety, you will increase the table height, vary beam angle and keep extremities out of beam. For operator, you have protective garments, increase distance from the source, optimize shielding, keep body parts out of the beam, and robotic cath lab. For both patient and operator, limit radiation usage, decrease cine use, minimize steep angles, keep keep detectors close to the patient, decrease frame rate, used software magnification, real-time dose monitoring, and collimation.